How can someone have bipolar mixed, means depressed and manic at the same time? In the old days, in the 19 something, we used to say you are either manic, means happy on the top of the world, have a lot of energy, impulsive spending, or sad, sitting in your bed. Now they discover there is something, somebody can be in the middle. That means you are impulsive and not sleeping, which is symptom of mania. At the same time, you are sad. Instead of being happy, you are sad and grouchy and angry. So we call that mix, means you have some of this and some of this at the same time. So remember, in typical bipolar, you are either in the manic phase or the depressive phase. And most of the time, you are always in the depressive phase. Only 10% of the time you will be in the manic phase. Now they discover this, they classify it more. They used to call it agitated depression in the past. They used to call it different name. They call it now mixed episode, means you have symptom of mania, means impulsive and agitated and angry and spending money. At the same time, instead of being high on the top of the world, you are what? Angry and grouchy and depressed. So we call that mixed episode. The reason is that there is different treatment for that. So the treatment for that, if you have it in the exam, the only medication that we use for that is called Latuda, Latuda is Lorazepam is the medication we use for that. I didn't give you the lectures for mood stabilizer, but so you understand the question. Now we're gonna have a lectures on Saturday, isn't it? Saturday on Zoom, Waheed. Saturday on Zoom from 1 to 3. This will be a review session. So before the review session, you all know my WhatsApp number. So if you have any question or concern, just send me so I can put it in the exam, okay? Promise? Just send me, we need this, so we'll put it in the exam. The review session will be 2 review sessions, one on Saturday and one on when? Monday? Monday evening, okay. Monday evening and Saturday from 1 to 3. This is very, very important to attend the sessions because most of the question will come from these sessions. Just don't tell Yaqeel did that, he will kill me. Okay? So most of the question will come from that session. I put the question, and the question is very easy, but if you attend the lecture, you should be able to answer all the questions. I don't think, my lectures you should not read a lot, you should just understand everything. Okay, should we start? So today we're gonna talk about addiction and substance abuse, and the lectures will be interesting. Today we'll have the first part, then tomorrow we'll have another part, and then we'll go on. So today is addiction. So start with the first slide, and we look at these cases. This is Brandon eating hamburger. See how excited he is? You can tell how excited he is. This is a regular hamburger. He smelled the pickles, the mayonnaise. This will drive him crazy because what will happen in the brain of Brandon? Anybody knows? What happened with him is there is a place in the brain called nucleus accumbens deep inside the brain. And when we eat, when we smoke, when we're in love, there will be increase in dopamine in this area of the brain, and that's what we call the reward system. So what is common between John, who is addicted to heroin, Ahmed, who is in love with his classmate, Jennifer, who is smoking, and Steve, who is alcoholic, and Firas, he is a friend of mine. This is a story of a friend of mine. This is 1980 something, I will not tell you what's 80. We were living in America at that time, and he was in love with a lady. And his real name is Firas, but we will not know what is his last name anyway. So Firas used to have a car, not like this car, similar to this car. So every day after 4 o'clock, me and him, he will put me in the driver's seat here, and we'll drive around her house for like 2 hours. If we don't drive around her house, he will not be able to eat or drink. He just was in love with her, and he is so madly in love that the day we spent like 2 hours, I've never seen her. I think she was not very beautiful anyway, but he was crazy about her, and he will not be able to sleep or eat unless he drive around her house. This is 1980 something. We were in. And I still remember it, so I try to put it for you. So what is common in all of these people is there is a place in the brain here called nucleus accumbens. You need to know this very well. It's part of the stratum. And when we eat this cake, for example, you say yum, isn't it? So the word yum means there is increase in the dopamine in the place of the brain called nucleus accumbens. Here is nucleus accumbens. An increased dopamine in this area of the brain will give you a lot of pleasure. So how discover that? They discovered it one time as a neurosurgeon was doing a surgery here, and when he touched on that circuit, the patient felt so well. So they found that this area from the ventral tegmental area to the nucleus accumbens to the frontal lobe, it's called the pleasure highway. Just I call it the pleasure highway. It's different name, but so anything can increase dopamine in this area of the brain, make us feel happy. Okay, make us. So nucleus accumbens is part in every creature. So if you bring a cat here and we took away her nucleus accumbens, she will sit in that corner for 3 days. She will not eat or drink, and she will die in 2 days or 3 days. So this is how essential. So we call that the pleasure highway, and the pleasure highway is or the pleasure signal. So when it's good, that means our brain here. This is what we call the survival brain. We call this is in the middle brain called ventral tegmental area, deep inside the primitive brain. Remember this area of the brain, we call it primitive brain. Primitive means it's present in all creatures. Even butterfly will have a primitive brain. It will tell us what is good for survival. So whenever something good for survival, it will secrete something called dopamine. So when I eat cake, for example, or drink coffee, or go to not McDonald's now, or Starbucks, we'll go, for example, to Dr. Keith and drink coffee, that will increase dopamine in this area of the brain and make us feel so good. If we don't have it, then we will not eat or get married or get in love or do anything. We will just die. So God put it in us to motivate us to see what is important and what is not important. So for example, if I eat these napkins or if I eat this cell phone, it will not increase my dopamine, so I don't eat it. If it's chocolate, I will eat it because chocolate will increase my dopamine, for example. So anything that increases dopamine, for example, I'll give you an example. Let's see, I did this lecture for you, and they gave me, for example, 500 riyal for doing this lecture. So let's imagine Waheed came today and gave me an envelope for 500 riyals for doing this lectures. The 500 riyal will increase my dopamine, and I feel good because he gave me 500 riyal. Okay? This is how the VTA work. Let's see if Yaqinuddin, instead of giving me 500, he gave me 700. Then more dopamine will be secreted here and I'll feel more happy. Let's see if he was mad at me and gave me 300. What will happen? Less dopamine will be released and I will be sad. So dopamine release here is about expectation. Is what? Expectation. So if expectation is much more than the anticipation, the reward is more than what I expect, then more dopamine. If it's less, there will be less dopamine. For example, if I, let's see, for example, strawberry will increase our dopamine, isn't it? So if I go home today and I was expecting my wife will be cooking kebsa and biryani, then a lot of dopamine will be secreted because kebsa and biryani will increase my dopamine. But for my bad luck, if I went home and my wife decided that I have to be on diet and gave me strawberry for lunch, what would happen to me? Although strawberry will increase my dopamine, but here is less dopamine will be secreted. So remember, this is very important. Here is expectation is about dopamine expectation. So the more, for example, here, and this is very important to know, this is in the primitive brain. Show me primitive brain. Yeah, in the most primitive area of the brain, so we don't have control over it. So remember when we said, you remember the lady named in the lecture for depression when she was in love with someone and her family refused that someone. And that's really not a great guy, but she was in love with him. So when her mother asked her why you are in love with him, she doesn't know why, because she is deep here, and here is not in our conscious, it's unconscious. So we don't know why we love someone and we hate someone. It's deep in our unconscious mind. So we have no control over it. And that's why Khalil Gibran used to say, don't talk to me about a person I see in my heart and you see in your eyes. So this difference. And that Firas is the guy we talk about in the first lectures, in the first of this lecture. The lady he is in love with was really very ugly. It's not good for any reason. But when his mother came, she was shocked that he is in love with this lady. But the problem with Firas, he doesn't know why, because it's in here. His mother is looking in the frontal lobe, the conscious brain, and in the conscious brain, this lady is really horrible. But in the middle brain, she is good. And that's what happened. And we'll talk about it a lot in that. So here we go. So we have something we call the nucleus accumbens deep in the stratum. And the more dopamine we have here, which come from here. So the source of dopamine is here, because this comes in the exam. Where is the source of dopamine? In the ventral tegmental area here. And it goes to the frontal lobe. So dopamine will increase here. This is what is called the pleasure center of the brain. Coffee, chocolate, food, intimacy, music, art, prayer. Prayer can increase dopamine. Family gathering, all of that we call natural reward. Really natural reward that when God sent us to earth, he said, make them happy, and earth is a very boring place. So that guy, Ahmed, when he was working with me one time, he was in love with a lady, and when she is present in the surgery theater, he will do a great job, because he described her, my cup of coffee. So he cannot function well without her. A marriage will make us happy and increase our reward. Love will do that. So pleasure, the feeling of pleasure that's related to survival brain. So when we see something increase dopamine, not only make us pleasureful, but that means it makes us survive. So we call that survival. So if I don't eat a chocolate or food, or if I don't see my wife and kids, I will not survive. And that's why, because they increase my dopamine. And that's what we call natural reward. That means what God gave us on this earth to have the reward. So all of you who carry coffee with you, carry water with you, is having increase in survival, because this will tell you, the primitive brain is telling you that if you drink this coffee, or you are in love, or you eat chocolate, you will survive on earth, and that's what happened in our life. So the middle brain is where our survival happened, and it's all in the primitive brain. And when it tests something and finds it increased dopamine, it will send a message to the frontal lobe and tell the frontal lobe, look, frontal lobe, we found something that increased our dopamine more than anything else, so make a note of it and make sure that we have it again. So the motto of the midbrain, that when it sees something increase the dopamine, it will send a message to the frontal lobe. The frontal lobe, please make a note of that, that when we ate that chocolate, we felt so good, and then when we saw this lady, we felt so good. That means make a note that we will try to see her again and have the same thing again and again, because this is what makes us happy. Make us happy means it increases our dopamine. Got it? If something did not increase our dopamine or make our dopamine low, then the midbrain will send it, hate this place, I hate this person, because when I see him, my dopamine will go, and I hate it. Okay. So this is what happens. So we said survival brain or midbrain have memory of whenever something increased dopamine, the more dopamine we have increased, the more it will be registered in our memory. So a friend of mine who went to Canada, he registered in his memory that the biryani in that restaurant is the best restaurant in the world, and he still have memory of that biryani, and he wants to fly back to Riyadh to eat in that place and eat biryani again. So whenever we see something that increases dopamine a lot, it will, the midbrain send a message to the frontal lobe, listen frontal lobe here. This is very important, because it's important for what? Survival. We will not survive without that thing. Okay? And that's what you call, for example, when you drink alcohol, not only the alcohol that make you happy, even the smell of cigarette, the music, the seeing people, everything here registered in the memory and it will make you want to go and drink again or use alcohol again, because the memory of that things that increase your dopamine make it salient. Salient means mutamayyiz, means very, very distinguished, means it's important more than anything else. So because it had increased our dopamine more than anything else. But what happened in addiction, this is another example, I'm sorry, this is going very fast, and I wanted to, careful with me here, just listen to me carefully here. I don't know why this working this quickly. Okay, here. So why we eat junk food or kapsa or biryani and not, for example, what is the difference between cucumber and this? Because cucumber will increase dopamine, but will not increase it as much as these four things here. And that's why you will not invite anybody to have some tomato and cucumber with you at home. You need to have all of this, so because more dopamine will be increased when we eat junk food and we eat essential food, because hamburger, it fools the brain that is more important than cucumber for survival. Cucumber will not make you survive a lot. This will make you survive because it will increase dopamine more than anyone else. And that's when we are in love with someone, because she increased my dopamine more than other ladies. So you tell your husband next time that you increase my dopamine more than any other person in the world. Okay. What will happen here is the food, we said food and sex will increase dopamine from 100 to 150, for example. And that's why we eat food. What happens when you use drugs like ketagon, you know ketagon and hashish and what we call shabu, all of this available here, will increase dopamine. Look at food. Look at ketagon. So what happens with drugs, it fools the reward system, and it will hijack the reward system, so it will increase it 10 times as much. What will happen to the brain? Why drugs are so dangerous? Because they increase dopamine a lot more, and then when that increase is way too much, the regular dopamine, natural God reward will have no meaning anymore. So you see patient, I have one patient who is addicted to ketagon after 20 years. I asked him, what is the meaning of ketagon for you? He told me that two tablets of ketagon is better for me than all the female in the world. This is how bad he is in that addiction. Because food and sex will increase his dopamine here. And that's meaningless. Has no meaning here. Because now he's changed his hedonic tone. It's become here. And that's how drugs fool the brain. It will increase dopamine 10 times more than normal dopamine. And then we become addicted to the drugs and alcohol and all of that. Because why? Why we are addicted to ketagon? Why addicted to hashish? Why addicted to cocaine? Why? Because they increase dopamine a lot more than they hijack the. Are you with me? You understand it well? Yes. Okay. You enjoy the lecture? Yes. Okay. Right. So in addiction to drugs and certain behavior, increase dopamine a lot more than natural reward that God gave us. So the middle brain here, or the primitive brain, will tell us is there is three things that is important for him, which is eating. Well, to survive means sexual activity and defending yourself. And this is the three important things that the middle brain care about. Sex, well to survive, and eat. This is what we call survival. Because without these three, you will not be able to survive. Okay? If you don't eat, you will not survive. If your parents did not get married, you will not be here. So you will not pass your gene to the next generation. So the middle brain is responsible for the three essential survival hierarchy. Okay? Clear? And this is so essential that we all fight about. What will happen with the drugs is, the drugs, as we said, will fool the brain because drugs increase dopamine a lot more than these three. So now drug is number one. And by far number two is the last. Why? Because drugs will increase dopamine more. So the midbrain doesn't care about halal and haram, wrong and right, harmful or not harmful, doesn't care. He cares about what? Dopamine. Is it increasing my dopamine more or less? That's what is the midbrain. And since drugs feel that these things increase dopamine a lot more, then he will say these three is not important anymore, I need to. And that's why you see drug user will kill themselves to get drugs. They might kill their family for drugs. They can do anything to get the drugs. Why? Because nothing important anymore. This is what happened. This is number one. More important than anything else. So it will hijack the survival hierarchy, and it will make us feel that the more dopamine. And remember, this is in the primitive area of the brain. So alcoholic patient will go, let's imagine, this is a alcohol or beer or whiskey or whatever. I know this is gonna harm me, but I don't care because it will increase my dopamine. This is what I care about, is my dopamine. So here, in the beginning, when you use drugs or alcohol, use drugs for party. So I'm gonna feel good, I will drink some alcohol to relax and feel good, I'll use some hashish to do that. In the beginning, it will be party. In the end, it will be drug needs. The midbrain will tell you, I will not be able to survive without this. No more. So the midbrain, in the frontal lobe, here drugs means happiness and pleasure. In the midbrain, it is what? Midbrain drug is survival. It's deep in the unconscious mind. What mean is an unconscious mind? That I mean I don't have control over it. That's why you don't tell anyone why you are drinking, because he can't stop. Why you are in love with that lady. When you ask her why you love this horrible girl, he doesn't know. And he cannot. Firas, by the way, did not marry that lady. He married 3 ladies after that, and he was never happy with her. I visited him last time, a couple of years ago, and he said he got married 3 times, and he still doesn't know why. He loved the first one in the beginning, and he still doesn't know why he didn't survive the other 2. So this is what happened. Because the midbrain is we really don't know what is the midbrain. So when next time your husband or your loved one asks you why you love me, tell me, I don't know. Because if you know, that's mean in here, and here it doesn't work well. Deep inside. Okay? Got it? So here is the midbrain. We start, or what starts with a joyful experience is now a life or death need. So what will happen now? So in addiction, it's beginning with a party, it's beginning with happiness, it's beginning with increased dopamine. Now it is a survival, it's death or life sentence for me. Because it changed my survival hierarchy. So without dopamine, this is what happened when you stop using alcohol. Let's see, you are alcoholic, or you are using shabu, or you are using alcohol. In the beginning, it will make you this party, and you will not be able to survive without it because it gives you the energy and the pleasure of all of that. When you don't have that substance in your brain, this is what can happen. That's why you go back and quickly start using. Why? Because the frontal lobe is what is our executive function. We will not, the more dopamine we have here, the happier, the more executive function we have, the more excited we are. Like Ahmed, when he was in love with that lady, when he do surgery, he is a very good surgeon, and when this lady is with him in the theater, he will do a great job. When I told him if I want to do a surgery, if I want you to make surgery for me, I will ask your loved one to be in the theater because you will do a great job when she's here. Because the survival hierarchy is so important, that dopamine. The dopamine here is what makes him do very good. Without it, he will be like this. So what happened is, we say dopamine in the frontal lobe is so essential for the function of the frontal lobe. The frontal lobe is our ability to plan ahead, predicting the consequences. Our executive function is here. And we need dopamine to have good executive function. Look for ADHD patient with ADHD. Why they cannot function very well? Why they fail in the exam? Because they don't have dopamine here. What is ADHD? ADHD is when you don't have dopamine in your frontal lobe. So you fail in the exam. You see, a night is the difference when you treat this ADHD patient. And those ADHD patients, if they got a hand on drugs, they will become addicted like in a second. They will become addicted. Most of these addicted patients, they have ADHD, but they never treat it. well for that illness, and that's why they become addict. So because the function of the frontal lobe need that dopamine to function better. Got it? Yes, right. So I will leave you with this. What will happen here is without dopamine in the frontal lobe, life with low dopamine, it's hard to function, it's hard to get out of bed, the brain feel awful, and you know that you need dopamine and you go and use it. Because you cannot live without dopamine. Right. Let's move here to the next part here. And we said what will happen is, let's see, our dopamine really is around 100. This is just a number, it's not real number, but let's see. Your dopamine is around 100 to 200. This is your normal fluctuation of dopamine. So usually it goes in the morning when your mother say good morning honey, it will increase a little bit. You drink coffee, you increase a little bit. You see something good, you increase a little bit. Then you get into traffic in Riyadh, it will decrease a little bit. And this is, you are in this range and you are normal and functional. What will happen is when you take a drug, look at me here, when you take a drug, the dopamine will go up to 1,000. Then it will not stay at 1,000, it will crash. But it will not crash to baseline. It will crash where? Way below. And when the dopamine goes way below to 40, the membrane get a notice. We are going to die. It's the same way. Like you are in the mall and you lost your baby in the mall, or you have very bad news. So what happens is when the dopamine crash to 40, it will not crash to baseline, it will crash way below. So the membrane will take a notice, and the result, when dopamine is 30 or 40, it's hard to function, it's hard to get out of bed, the brain feels awful, and the membrane will ask the frontal lobe, Mr. Frontal Lobe, what have you done? We are here at the 40s. Am I going to live today or am I going to die? So the frontal lobe immediately call the drug dealers, get me some ketamine, get me some alcohol, because I'm going to die. Got it, girls? So here is when the ventral tegmental area has no dopamine left or no dopamine sent to the nucleus accumbens, when dopamine get level 30 or 40, we are not living. And then you change your hedonic tone. So this is you normally, happiness, sadness, dopamine high, dopamine low. But in addicted, it's either too high or too low. And this is where it's dangerous, and this is where it's dangerous. I'll give you an example. When I used to live in Tennessee, this is like 20 years ago, my neighbor's kids used to wash my car. At that time, I gave them $10 for washing the car. And these two will get so excited about the $20. Wow, they have like a party. We're going to go and have fun and drive and go to the mall and eat hamburger. All of that because of that $20. Sometimes I will wash it myself and get it $20 and I feel so happy. My car was white, this is it. But let's see, let's imagine I tell Bill Gates, I will give you $20 and you wash my car. What will Bill Gates say? Exactly. Even $20 million he will not wash my car. Doesn't mean anything for him. And that's what happens in addiction. In addiction, when you say, I'm gonna give you biryani, or coffee, or take you to Paris, or Burj Khalifa, or whatever, because they will increase his dopamine to 200. But he gets used to what? Like Bill Gates. So for the change in the hedonic tone, you got it? Change in hedonic tone, that means you will not be able to survive because your system had changed. You adapt to the high level. You cannot adapt to the low level. This guy who washed my car now, he is very, very well neurosurgeon. He is still a friend, his mother is a friend of ours. So he is now a neurosurgeon in America. And if I tell him, I'll give you $20 and come wash my car, he will not do it. You got it? This is what happened. And that's what you see here. Look at this lady. This lady was a police officer in New York. After using Captain this is her after 3 years. But all of you will ask, look at her teeth, for example. For God's sake, she can go to the dental clinic for free and fix her teeth. She can go and buy all of this skincare. Women care most about their skincare. But she will go. Even for free, she will not go. Why? Why? Because it's not important anymore. Same like baking. You give him $20. So this is what happened to the ladies here. Look at what happened to them after using Captain. The dopamine cell, after using all of this, they change their hedonic tone. So they don't care about their look or about anything. Why? Because the change in hedonic tone was so bad that normal guard things that give us doesn't make it. So methamphetamine, like Captagon abuser, eventually, what will happen after 1 year of using these drugs? They don't feel good anymore, but they have scare of being withdrawal symptom. They have scare of withdrawal symptom. Because most of the dopamine cell will die quickly because you are work them, and then you see a patient who used Captagon after 20 years, you look at them in our hospital, there's plenty of those. They look like this. No emotion, no feeling, just existing. They don't care about women, about food, about anything. They just lost their dopamine cells because when you abuse drugs, because we don't have many dopamine cells in our brain, very few, less than 0.1%. Not even 1%. 0.1% of the brain cells are dopamine. And that's what happened. Because what happened to them, as we said, to summarize what we said, is a chronic state after effect. So what happened is, without dopamine here, we cannot function, we cannot go out of bed, we get used to the high dopamine, and then when our dopamine crashes to here, we feel scared because we feel about to die, so we go back and use the dopamine again. We use Captagon again because the survival brain tells us that with 40 level of dopamine means I'm going to die. And that's what happened. Now this Captagon could be anything. Maybe could a person you love that make you dopamine. I have a friend of mine, he is a surgeon, he still lives in Riyadh, and when we were in the college, he used to like food and hummus and falafel. So his dopamine only comes from falafel and hummus and food. So for example, he knows all the restaurants in Damascus who serve this, and he knows everyone. He has the menu for each one of them and how each one of them tastes better than the other one. So this is what happens when we have something addicted to. This is what's called addiction. So how we become addicted? We didn't wake up in the morning and we become addict. Addiction is like a language. You learn English not in 1 day, not in 2 days. It's a process. So the more you use the drugs, the more you become addict. The more frequent, the more. So the more frequent, the more you become an addict to that person. And it's built in your genes. Some people might drink alcohol once or twice, might smoke marijuana once or twice, and not be addicted. But some people will immediately, it's built in your genes. So if you have a gene or environment. Some people, if you have ADHD, you are more likely to be addicted, no matter what you do. Why? Because you have low dopamine. And drugs will make you feel normal. So that's why if you have an ADHD person, you need to treat him quickly because these patients will become addict if you don't treat them. I always tell them we are cheaper than the drug dealer across the street because they go to the drug dealer and use drugs. So that's why if you treat ADHD, you prevent addiction. So why do people use drugs? To curiosity, peer pressure, anxiety, depression will make you use drugs because when we are depressed, we have low dopamine. So when we smoke or use drugs, it will raise your dopamine. So some people will self-medicate themselves by using the drugs. What is the substance? Caffeine, alcohol, cannabis, hashish, hallucinogens, inhalant, opiate. America has a lot of opiate. Here we have a lot of what we call hashish and stimulant here, tobacco. All of this have one thing in common. They all do what? Increase dopamine and then close the comments. Okay. Why it's very dangerous if you use drugs when you are a teenager? Because if you use drugs as a teenager, your brain is still in the making, you're still under construction. So if you use hashish here at age 15 or age 21, hashish and alcohol will become part of your brain. It will be very hard for you to get out. That's why in America and everywhere you should not smoke before 21. They got the law because of that. Because if you use alcohol or drugs before age 21, you will become addicted to it. If you use it after that, you are less likely to get, because it's become part of your material of the brain. So the question is, God always has balance. He will not put one thing without balance. So what happened is we have two, we say, look at me here, look at here. So we have need. I need to get married, I need food, I need intimacy. And this is basic need. I cannot live without them. So God said, okay, Ali, you're going to have all of that. Why? Because this is need, and need is important, and you get married and give you money to buy food and all of that, and give you kids and all of that. So you will satisfy your basic need in the primitive brain. And we'll give you something called the frontal lobe. The frontal lobe will tell you, Ali, it's haram to drink, and drinking will damage your liver. So the frontal lobe will tell the midbrain, okay, midbrain, we might be able to drink a little, but we cannot drink too much. And there is balance between the midbrain, your need, and the frontal lobe, that is your kindness. What will happen in addict? In addict, the more drug you use, the weaker the frontal lobe and the stronger the midbrain. So every time you use drugs, this will become weaker and this will become stronger, and you end up without a frontal lobe. That's why after many years of addiction, you don't care about anything because your frontal lobe is gone. The part of the frontal lobe that tells you this is wrong, it will become obsolete or not working great. Right. Good. So what happened is, why we don't stop using drugs? Because drugs in the beginning make us feel happy on the top of the world, but after using drugs for many, many years, they will not do that because you don't have any dopamine left. So why are you still using them? You're still using them because of withdrawal symptom. Because when you stop using alcohol, when you stop that ketogol, when you stop that marijuana, you're gonna feel awful. Withdrawal. So you go back and use drugs because you don't want to be like this. Because memory of what happened last time, when you stop using the alcohol, you will go through severe withdrawal. We're going to talk about it tomorrow. But what will happen if you stop using the alcohol, if you are alcoholic and you stop using it suddenly, then you will become like this. Cannot function. So you need to go back. And you're going to have this. You're going to be vomiting, you're going to have high blood pressure, you're going to have panic attack. Panic attack happen also when you stop using the drugs, you see. Because the ventral tegmental area, we say the middle brain will send a message to the frontal lobe that we are about to die. So you go back and using the drugs, not to get the pleasure of the drugs, but what? To prevent it. Because you don't want to feel miserable. Okay? You just want to feel normal. So, what is the substance? Okay, here. This is the substance withdrawal. This is what happened. The memory of vomiting, sweating. This is another part of it. What is the common? We mentioned that. What is the route to the brain? Why people will start for cocaine or drugs? They use first tablet. Then tablet will not increase the become tolerance for the swallowing. Then you go to inhaling a little bit more happier. Then you go to the IV. The IV, that's when you are way deep in the addiction. Because IV is the quickest way to the brain within 2 seconds. Here take a few minutes, but IV, so that's why IV drug user will become very, very addicted because they get used to the highest level, and that's why they get HIV and a lot of infection. Warning sign, this is important. I think this will come in the exam. How do you know that your kids is addicted to drugs? You see they are isolated, withdrawn, the red eye, they are not excited anymore. You don't see a lot of excitement in them. They become withdrawal, less engaged, low motivation, low interest. But the question is, and I want you to listen to this quickly and carefully. Look at it. They put in the cigarette that cigarette will kill you, make you have cancer. Alcohol will make you have cirrhosis of the liver. Fast food will damage your brain and be bad for you. But all of this ad did not work. Why? Ask one of you. All of this ad did not do anything. Yes?
Because there's a feeling that it wouldn't happen to that person.
What?
There's a feeling of like it wouldn't happen to me.
No, they are already used that. They don't. Yes?
Because when they see it, they get more stressed and they need the real medicine.
Yeah, this is one reason, but this is not the real reason. Yes?
They already think they're gonna die anyway. They don't take it.
Yeah, that's a good reason. Yes?
Because they can't think of it logically. It's a mechanism of
You are close, very close. Yes? Yes?
Because the prefrontal cortex is not working as well as it usually does.
You are very, very close. So the problem is, when you talk, it's same like when Firas' mother came from Syria. She looked at that lady, and she told me this is the most horrible person I ever seen. Okay? She is seeing her at the front of the room. He is seeing her where? So we are talking different part of the brain. So when you tell the person alcohol will kill you, cigarette will kill you, you are talking to the frontal lobe. The frontal lobe knows that. Knows alcohol will kill me. And knows cigarette will do that. But the problem is not in the frontal lobe. The frontal lobe has no relation with all of that. What is the problem? This is the problem. When Mary, remember the lady, Mary, who is in love with that guy and family felt it's not good for her, but she didn't listen to them. Why? Because love isn't here. Love is not in the logical part of the brain. That's why you don't ask someone why you love this, and you just get married and get over it. Same thing, because anti-smoking ad, anti-alcohol ad, anti-fast food ad does not work because those all increase dopamine in the frontal lobe, and the frontal lobe is low. So you need to function to make you need to do psychotherapy to get the frontal lobe more control. How we do that? We teach our kids how to be self-controlled. So we wake him for Salat al-Fajr. You tell him that, remember the marshmallow trial? I want you to know this marshmallow trial. Very, very important. Marshmallow trial is you need to read about it, is they brought about 40 kids, grade 3, and they told them, the professor told them, is all of them had very high IQ because their parents work at Stanford, so they have very IQ. So he asked them, I'm going to give you one marshmallow now, or if you wait for 2 hours, I'll give you 2. So some people wait for 2 hours, some people could not wait. And they follow them for 2 years, and they noticed that people who wait for 2 hours, they did very much better in all exams later on. Why? Because that's when they have a good frontal lobe that able to control that. So when you teach your kids how to be strong here, then he will not be able to do it. Because you teach him how to control. Because the problem in addict is a simple way. What is the definition of addiction? Is failure of the frontal lobe to control the lower brain. So repeat for me after me. What is the definition of addiction? Is failure of the top control of the frontal lobe on the brain. So when that fails, then you just lose your frontal lobe. So how I can increase my frontal lobe activities? By giving them hardship and making them tolerance to that. So what will happen if they stop using the alcohol? They will have withdrawal. Withdrawal, I said, what we said is the amygdala will send a message, locus coeruleus in the middle brain here is where locus coeruleus, will send a message to the amygdala, and then we are dying, and then we'll have a panic attack. Panic attack happens when we do that. And why it's very hard to stop is because the memory of the drugs is very, very strong. This is the memory of the drugs, and this is molecular memory. See the difference? The more you use the drugs, the stronger the memory of the drugs. So when you suddenly stop using the drugs, you will feel Because the same thing, when you lose some loved one, you will stay depressed for a couple of years. The memory of that mother or father, your brother, is so strong in your midbrain. So when you lose him, you become awful. Same thing, alcohol is like your brother or mother. When you are an alcoholic, if you stop using alcohol suddenly, you will have the patient will tell you, I feel empty, because the memory of the drugs is deep inside your brain, have deep meaning, deep representation in your brain. And we'll finish with the case of Ahmed, and this is a very interesting case. You know I like cases, because cases will stick in your brain. So this is what happened. I want you to listen to this carefully. Ahmed is one of the patients who is very religious guy, and who is brought up very, very well. He one time went to some other countries, and he had one day session with another lady. He had some intimacy with another lady. After that, he felt so bad. He came to me crying, depressed, want to kill himself. He said, I want to go and volunteer with the Mujahideen somewhere and fight for the sake of God, and I want to devote my life to, we call that defense mechanism called undoing. Undoing means I want to undo the guilt feeling I have after I had that affair. And most people, when they do something like this, that's why God haram zina, it will make you so depressed. It will increase your dopamine in the beginning, and then it will crash to 40. And then he was in the 40s dopamine when he came to me, crying when he killed himself. Or when I undo that by becoming, working with the Mujahideen somewhere, and devoted himself to God and to repent, to clean his sin. So what would happen in the brain here? What happened in the brain? See, what happened is, and I think this is the frontal lobe. So when he got excited and did what he did, dopamine increased way high, and then after the act, it will crash to the level where I'm about to die. And then the frontal lobe, which is a critical part of the brain, start talking to him, you did haram, la yajuz, kaza, all of that. Because what happened when dopamine go very high, the frontal lobe, just the amygdala and the midbrain will tell the frontal lobe, shut up. That God knows our weakness. He told us, don't be close to a woman, no. Because once you become too close, then it's done. Because we have very weak sense of controlling the frontal lobe, controlling the amygdala. So that's why God, وَلَا تَقْرَبُ زِنَا, not the zina, تَقْرَب. And once you become very close, then it's too hard for your frontal lobe to interfere. Because the amygdala and the midbrain will take over the frontal lobe, especially in man. Very weak. Only Yusuf alayhi salam was able to do that. Very few. That's God knows our weakness, told us don't be close to a woman and be with her in one place, because the midbrain will get you so excited that you will not listen to the frontal lobe. Because the frontal lobe still knows this is haram. So what would happen? What is the difference between regular marriage and this is the same here? What would happen? What is the difference between regular marriage and love and when they stand for zina? That's not Allah. In marriage and love and romance, not only dopamine, there's a lot of neurotransmitters that we secreted. Oxytocin, vasopressin, dopamine, all of that melt and give you the happiness of marriage. In zina, it's only this one, and this one is not that good. It will crash and end. But in real marriage, it will be all of these neurotransmitters together that give you the romantic feeling, the love, and feeling good. That's why you don't have that feeling in marriage. You have it when you do something haram. Got it? Because it's not only one neurotransmitter, it's like 20 neurotransmitters that will be secreted. And mainly this one and this one. This one more in female and this one more in male. Got it, girls? Yes. That's why God said, zina is haram, 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 haram. Why? Because it will destroy your nervous system. It will destroy your blood system. This is when God created you, He doesn't want you to have it this way. He wants you to have it this way. One ingredient here is like 20 ingredients. It's like when you make kafsa and you just eliminate it with a chicken. It will not be a good kafsa. So here this is a summary, and this is also a summary for you. And thank you very much. Do you have any question?